A very good evening, everyone. Today we have Vaishali Rai, a theatre and a voice-over artist, an actor and event host. She will be the anchor for this program, asking the right questions to the health experts. Let's welcome Vaishali Rai, anchor Wellness
A
Wednesday.
very good evening, everyone. Namaste and Mabuhay. Welcome back to another health awareness episode of Wellness Wednesday. As you all know, every first Wednesday of the month, we bring to you a topic that you would like to know more about. I am sure there have been times when you must have wondered, what if this happens to me? Wellness Wednesday helps you to gear up for that what if moment. Today's episode is about something that every woman will have to deal with at some point in her life, the dreaded menopause. Or should you dread it at all? We have Dr. Vinita to help us understand this issue so that we are aware and can embrace it when it happens. This program is brought to you by Ivy, a not for profit organization, a platform dedicated to women in enterprise in the Philippines. The Wellness Wednesday episodes are brought to you as part of our India Philippines Friendship Initiative. In our mission of creating health awareness every month, we a well-known medical expert with a brand new topic. All you have to do is ask the right questions in the comment section and we will get the expert to them. We have covered an array of topics till date, such as healthy heart, ergonomics, cervical cancer, skin care, eye care, and nutrition for women's health. For those of you who have missed our previous sessions, it is available on our YouTube channel, the link of which is below. So please do subscribe and share these videos to create health awareness. You never know how that click of yours could help someone. It gives me great pleasure in introducing our guest for tonight, Dr. Vinita Sharan. Today's episode is actually very special for us at Ivy, as Dr. Vinita Sharan, along with Dr. Toral Mehta, had the idea to bring health awareness to the general public. They together joined hands with the team of Ivy to bring this idea to life. Dr. Vinita Sharan has recently moved back to India after living in the Philippines for the last 22 years. She has been a professor at San Beda College of Medicine, Manila for the last 16 years. She was closely associated with Makati Medical Center. She completed her master's in public health from London School of Hygiene and Tropical Medicine, University of London. Currently, he is an advisor for Radiology Continued Medical Education, or CME, for the Global Association of Physicians of Indian Origin. She is a lifetime member of Federation of Obstetrics and Gynecological Societies of India. Dr. Vinita, hearty welcome to Ivy's Wellness Wednesday. Thank you so much for taking out the time for our viewers tonight.
Thank you so much for inviting me for this talk. It's really nice to be here and talk about something that is really important in every woman's life.
True, true. But first of all, hearty congratulations to you. I would actually like to tell our audience that Dr. Vinita has recently, in June 2022, accomplished her master's degree in public health from London School of Hygiene and Tropical Medicine, which is from the University of London. So, doctor, what inspired you to continue studying now after having so much of experience and knowledge already?
Well, Vaishali, as you know, knowledge and experience is never enough. First thing is that. And secondly, I think when I was doing my fellowship as in breast imaging, I found that the burden of breast cancer in the Philippines was really high. And way back in 2005, I started doing these awareness talks so that women could go for their screening mammograms and be proactive about their health. And slowly, my interest in public health became more. And I found that as a physician, you look at a disease or a patient in a different manner. And when you're looking at the public health aspect, you're looking at many aspects of the health of people, the disease, the burden of disease, and how it can be corrected. So probably that is what inspired me to go ahead and do public health also. Thank you.
Amazing, amazing. Hats off to you for still going through this, studying, and also in turn helping the public with this. Really. Congratulations once again.
Thank you. Thank you very much.
So, friends, we have gathered today's questions from Ivy's members and communities. For those of you who are watching this, if you have a question, do send them in the comment box below. We will try to accommodate as many questions as possible. If we are unable to answer them during the program, we will get back to you later. We are prioritizing the questions that were received earlier. So, without further ado, our first question for the day, Dr. Vinita, what exactly is menopause?
So, in one sentence, if you ask me, then menopause is actually the end of a woman's reproductive life or her reproductive years. This is the time when her ability to procreate stops. And if a woman has not had menstruation for consecutive 12 months, then we'd say that she has reached menopause. And actually, this pause is actually a stop. So the menstruation stops forever, for life. And to understand this a little better, let's talk about what happens in childhood. So every female is born with a certain number of egg follicles in her ovaries. And at puberty, menstruation starts. And with every cycle, a certain number of cells, they start maturing. But there is only one egg cell that matures as an ovum and is released. The rest of the cells that were trying to mature, they disappear or they atrophy. So every cycle, a large number of cells or the egg follicles are lost. And over the years, the number of follicles becomes less and less. The ovaries also secrete hormones like estrogen and progesterone. And over the years, with the reducing number of follicles and the activity of estrogen also becomes less. The hormone level of estrogen and progesterone also becomes less. So there comes a stage when ovulation stops and there is no menstruation. And if it continues for 12 months consecutively, then we say that the person has had reached menopause. And this is normal or process of aging, and this is normal menopause. But there are some women who undergo surgery. So they have either the uterus removed or the ovaries removed or both removed, and they then have menopause. And there are also certain medical conditions like hyperactive thyroid, or there are some medications that can induce menopause. And then also there are cases that patients have cancer and they receive radiation. And because of the radiation they receive, they undergo menopause. So there are different ways in which menopause can occur.
Okay, and then, doctor, what is the ideal age that one can attain menopause?
So there is no ideal age for menopause. Typically, it should occur somewhere around 45 to 55 years of age. Some literature quote 51 years as the average age of menopause. However, if, as I said, there may be some conditions like a surgery or radiation that can induce menopause much earlier. And it is not normal for women under the age of 40 years to have menopause. So if someone has menopause before they turn 40 and they don't have any history of any surgery or any treatment, then they should consult a doctor and they should have investigation as appropriate.
Right, right. So there is a natural process that can be induced because of certain surgeries, etc. And as you say, uh, if you have these symptoms or you're not having your menstruation before the age of 40, then definitely you need to go and see a doctor. and consult them about menopause, right?
Yeah, yeah.
So, what are the stages of menopause and what changes take place in each stage?
So when we talk about menopause, it can be divided in three stages. One is the perimenopause, the second is menopause, and third is postmenopause. So the first, that is perimenopause, is also known as the transition phase. So typically it starts around 2 to 3 years before menopause, but for some women it can even be up to 10 to 12 years before the menopause sets in. So there is no fixed period of transitioning. And during this stage, as I said, the number of egg cells have become fewer, and there is a decrease in the level of estrogen and progesterone. So in this stage, you can expect fewer number of menstrual cycles, and you can also expect scanty menstruation. So in this transition phase also, there is early phase and late phase. So we say that a woman is in early phase of transition when the length of her menstrual cycle increases. So for example, someone who was having menstruation every 28 days starts having a menstrual cycle of like 35 days or 40 days. So she has menstruation every 35 days or 40 days, or the woman has skipped a menstrual cycle. So this is an early stage. And when we have a late transition phase, then the woman has had no menstruation for 3 months, more than 3 months, but less than 12 months, because 12 months is the time when we say that menopause has actually happened. So between 3 to 11 months, if a woman has missed her menstruation or has not had menstruation, then she is in the late transition phase. And sometimes we say that women who have not had menstruation for 3 months consecutively, then most likely she will have her menopause in, suppose, next 4 years. And some women who have had a prolonged menstrual cycle, suppose they have not had menstruation for 45 days, so they are also likely to have menopause soon. The second phase is the menopause. When I said that if someone has not had menstruation for 12 months, then we say that menopause is reached. And one more thing, the symptoms of menopause that we talk about all the time, they are most common during the perimenopause stage, the time when you are transitioning from a regular menstruation to irregular menstruation. That is the time that most of the symptoms occur. And these symptoms will persist in the menopause phase. But when the person has already had 12 months without menstruation, we say that the menopause has set in, then the woman transits into post-menopause stage. And after this, she would expect that, her the symptoms that she was having because of menopause, they should subside and she should stop having hot flushes or other symptoms. But then she is at a greater risk of some things like, bone health deteriorates. She can have osteoporosis or she can have heart disease because of the low estrogen level in the body. So the postmenopausal stage is the third stage, when it is already 12 months since the woman has had her last menstrual cycle.
Right, right. So this definitely happens gradually in a woman's life. It just doesn't happen overnight, right?
Yes, yes,
And
yes. It
you
takes a
spoke
few
about
years.
right. You spoke about symptoms. So, what are the symptoms of menopause? Are these changes and symptoms the same for all women, or do they differ, and why?
Yeah, so, when people talk about the dread from menopause, it's basically the symptoms that they face in the perimenopausal phase. So all these symptoms are generally related to the decline in the level of the estrogen hormone. So amongst the different symptoms that happen, the most notorious is hot flashes. So you may be sitting in an air conditioned room and suddenly you will break out in sweat. You are suddenly sweating. Everyone is very cool and you are, sweating. So that is what is hot flushes. And if it happens in the middle of the night, you are sweating. So then it is called night sweating. So, by the way, you don't need to be in an air conditioned room for the hot flashes. It can occur anytime and anywhere. The next symptom that women face is dryness in the vagina. They have low sex drive. There are also uterine changes taking place in the body. Women also have sleep disturbances, mood swings, depression, memory loss, concentration issues. There may be recurrent UTI, urinary incontinence. Some women gain weight around the abdomen and hips. There would also be dry skin and dry hair or loss of hair also. So these changes are generally, as I said, related to the drop in the estrogen level in the body. And these changes are similar in every woman, but the response to these changes are very different. Many women transition from a regular menstrual, cycle stage to perimenopause and menopause without any symptoms. So they don't really feel anything. They just has one day, they have stopped menstruation and then it continues and they become completely fine. They don't have hot flashes. They don't have any symptoms. But there are some women who have so many problems that they find it very hard to adjust to that. So the symptoms are very different. And even if women have similar symptoms, then the degree to which they feel it will be very different. And this is because every woman is as unique as her thumbprint. So every individual is really an individual. So it really depends from person to person what symptoms they feel and to what intensity they feel it.
Right. I really like the part where you said that every woman is unique. And friends and ladies out there, please take a note of all these symptoms. And if ever you go through any of these, you can know and sense what is happening to you, and you can go and see your doctor with regards to menopause. Doctor, can you suggest some practical ways of managing these symptoms?
Yeah, so I can talk about some of the essential ways or probably some of the self-help ways of managing these symptoms. Because it's not a disease, right? So we don't generally treat it as a disease, and there is no single cure for any of these symptoms that women face. So generally, we try to manage them symptomatically. So for women who have hot flashes, they should know that hot flashes are aggravated by food that are spicy, so hot beverages, warm temperature, stressful conditions, smoking cigarette, consuming alcohol, consuming caffeine, certain medications, they all aggravate the hot flashes. So if you control these, you may be able to control the frequency of the hot flashes. The hot flashes will not stop, but at least the frequency will be less. And there are other self-help methods also, like you can choose to be in cooler places. You can wear layered clothing so that if you suddenly start feeling warm, you can take off a sweatshirt or a sweater or something and then still be comfortable. You can carry a fan with you, a hand fan. So if you are feeling too warm and you feel like you may be breaking into a sweat, then you can use the fan. Also, like some physical activity, like starting from your household chores to swimming, walking, tai chi, zumba, anything you do that keeps you physically active, that will help a bit with the hot flashes. Also, I think deep breathing. If like you are an executive and you are in a meeting and you think that you would, or you feel that you would be breaking into sweat or suddenly start feeling warm, if you can quietly take a few deep breaths, then probably it might help you with the hot flashes. And of course, there was some reading that I was doing, and I found that a very nice trick, like if you have night sweats, then you can have an ice pack under your pillow. And when you suddenly start feeling warm, you can reverse the pillow and feel the coolness on your, face and feel better. So this is another way of keeping yourself cool when you are feeling warm. Then there are some remedies that goes in the family itself. Like if you ask your mother or a grandmother of what happened to them, did they face perimenopausal symptoms, and if they face these symptoms, what they did for getting relief, and some of their techniques and therapy might help you, and it might work for you, because I said everyone is unique, but you will have some similarity with your mother, grandmother, may not be with your friend, but someone in your family can help you better with understanding how to manage the hot flashes. Of course, there are also some non-pharmacological treatments, but I will not go there because it is not, they are not backed by robust research. And lastly, for hot flashes, some people also take hormone replacement therapy, but only when it's a very extreme case and you're not really able to manage that well with your own techniques. Only then you need to go and request for a hormone therapy, or you can see if it will fit you to have the hormone therapy. So next, let me talk about the dryness in the vagina. So low estrogen levels, they lead to thinning of the vaginal lining and decreased lubrication. And this leads to painful intercourse and also bleeding after sex. And that is why also some women have very low desire for sex, because it's a painful experience. And some women may also have some inflammation in the vagina. So for this, there are a number of vaginal lubricants available off the counter, and some of them even may have some estrogen gel. So these can help with the lubrication, and since in this case, you are giving estrogen, locally applying the estrogen, it will have less harmful effect. So dryness in the vagina can be treated with this gels and keeping it well lubricated. There are also changes seen in the uterus. The uterus generally will shrink because the estrogen and progesterone are less, and there is thinning of the uterus lining. So women who are on hormone replacement, women who are on hormone replacement therapy may have bleeding or spotting for the first few months. But women who are not on hormone replacement therapy, they should not have bleeding after menopause. So if there is bleeding after menopause, then it must be investigated, because postmenopausal bleeding is associated with cancer. So for other symptoms, women may have urinary incontinence, and this can be managed by pelvic exercises. I'm sure many women who go through the perimenopausal stage or even postmenopausal stage, they have less capacity to hold urine. So the frequency to urinate becomes more, and sometimes even with a cough or a sneeze, you might find that a few drops of urine has come out. So in those conditions, some pelvic exercises can be done to manage that. And there can be some bladder training. Like one way is that you hold your urine for 5 extra minutes every time you feel the urge to urinate. And then you increase this by 5 minutes every week and see if it helps. There are also some exercises called the Kegel exercises, and they can be done for increasing the strength of the pelvic muscles, and they will also help with incontinence. Women in this age also are prone to recurrent UTI. So the best thing to do is that they should go for culture and sensitivity of the urine and take treatment with appropriate antibiotics. And I think the caution here is that do not stop the antibiotic when you have relief of symptoms. You continue with the course of antibiotic and complete it. So if you stop taking taking antibiotics once you have some relief of symptoms, what happens that you are building up resistance in the bacteria. So the bacteria becomes less and less resistant to those antibiotics. So always, complete the course of the antibiotic. And then there are also these cranberry tablets that can be taken. So if they come along with probiotics, they also help with recurrent infection. One thing that many women want to attribute to menopause is weight gain. Although this low estrogen has some role in weight gain around the abdomen and hips after menopause, but that is only one factor. Other factors like lifestyle and genetics really play a big role or a bigger role. So, being those who are overweight at a younger age, they are more prone to gain weight after menopause. So, mindful eating and increased physical activity should help. So, that should be done. So, healthy living is very important. Some women also have mood swings and depression, but these are not clearly linked with menopause. Mood swings can occur during premenstruation, the PMS that you hear about. So there can be mood swings even then. But mood swings are also very common in perimenopause. I think one of the reason can also be the hot flashes and the night sweats. So if that disturbs your sleep, if if you're not able to sleep well, you are prone to be grumpy and you feel that you have mood swings, you eat more, everything gets disturbed. So a good sleep is very important. And something about the mood swing and depression or sadness along with menopause is because some women treat it as a loss of the ability to bear more children, even if they want or not, but that ability should be there. So once that ability is gone, they do feel a sense of loss. And also, there are many other family and social issues occurring at the same time that make women have mood swings or even go to sadness or depression. So how to say that, it's just that women at their age when they are having perimenopause or menopause, that is also the time when they are peaking in their career. So their responsibility generally has increased a lot in at work front, and there is also increased responsibility at home front. Many women at that time have their children that fly the nest. They go on with their own careers, so there is also a sense of loss. And then that is an age when you also have aging parents, and aging parents, they need your support, your care, your love at that time. So that also adds to the stress. So some women are not able to handle all of these stresses together, and they have more mood swings and also kind of depression, but not really depression. I mean, that is more of a sadness that they face. And women who have actually had depression earlier, they are more at risk of having a recurrence during the perimenopause phase. So for this, again, a healthy lifestyle, breathing exercises, yoga, good sleep, they should be able to help get over these symptoms. So generally, it is prescribed that everyone should have 7 to 8 hours of sleep routinely. So I think women who take these changes positively are happy that that they are menopause now. They don't need to worry about the monthly hassles of these periods. They don't have to worry about unwanted pregnancy. So those women who take it more positively, they are able to deal with it better. However, I will say that if you really need help with your mood swings or your sadness or depression, then you should always seek help from a physician, or you should go for cognitive behavioral therapy, and if need be, even pharmacological treatment. So don't ignore that as just being part of, perimenopause. If you really have severe symptoms, then you should seek help. And there are also women who have this loss of concentration that occurs with aging. So menopause and aging are going together. So everything that you have in aging, you will also have in menopause. So that is a given that you will have memory loss or concentration. I think a lot of women have this problem that, including me, that when you enter a room for a purpose and you enter the room and then you realize you forget what you came in that room for. So you came for something and then you don't remember what you came in for. So I think these can be really treated by learning new skills. Like if you are a right-handed person, you can start using your left hand for most of the things that you do in everyday life. Then you can learn a new language, do crossword puzzles, Sudoku, learning a new sport or a new musical instrument, or just going back to what was your hobby or a passion. That will all help in keeping the mood better and having a better mental health.
Right. Thank you so much, Dr. Vinita. Uh, Friends, this has been a very elaborate and extensive explanation, and really said very beautifully. If you would like to go back to this video will be posted on our YouTube channel. So you can go back to this anytime, and you can hear Dr. Vinita's answers anytime that you have this question in your head. So, Dr. Vinita, how can a woman prepare herself positively to make these menopausal symptoms bearable?
Okay, so before I answer this question, let me talk about two principles in management. One is called the complicated easy, and the other is called simple hard. So when we talk of complicated easy, these are tasks that are very complicated. It's very hard to comprehend them. But once you have understood what the work is about, then you can do that very easily. On the other hand, there are some tasks that are very simple and easy to understand, but really very hard to practice. And these are called simple hard. And if you ask me, the preparation for menopause is a simple hard management technique. So the requirements for this easy transition to menopause and maintenance after menopause is based on simple principle of healthy living, healthy eating, being active, avoiding cigarette smoking and alcohol intake, avoiding spicy and oily food, avoiding sugary drinks, and high calorie food. We all know that these are healthy ways of living and can help us in transitioning well from regular menstruation cycles to a menopause. So I think we all know it, right? But how many of us practice that? So when you ask me this question, it's really the remedy is really simple: healthy living, healthy eating, being physically active. But it's really hard to practice. So I would say that just remember that menopause is a normal aging process. It is like the graying of hair. You cannot prevent that. Just accept it and live happily with it. So you can lead a happy and healthy lifestyle, and things should generally fall in place by themselves.
Very beautifully said, Doctor. Totally agree. It is so important to follow a healthy lifestyle. But the problem is, it is really very hard to follow a healthy lifestyle these days. But I guess we have to just work towards it. Doctor, many women wonder if they even need to see a doctor when they feel that menopause is due, or they have entered the menopausal state. So, what is your advice to them, and what is the right time to consult a doctor?
Okay, so as we have been discussing this, menopause is a normal phenomena, and many women transition from menstruating phase to menopause without any problem. They do not experience any symptoms like hot flashes, etc. So now the question is that when do you consult a doctor? I think for women who have, who have active sex life, the first missed period should always be evaluated for pregnancy and not menopause. So once the pregnancy is ruled out, then consultation, in particular for menopause, is need based. If you have symptoms that hamper your daily life, then you need to consult a doctor. But if you do not experience any symptoms that bother you, then you can continue with your regular checkups to ensure that all is well. So I think for women who have menopause in the age of 40 to 45 years and they have no history of uterine or ovarian surgery, they should consult a doctor and have their hormone level tested. Like they can have the estrogen tested or the follicle stimulating hormone tested. Their high thyroid function test may be tested to see if it is the cause of early menopause. But I think women who are above the age of 45 and they have irregular menstruation and no symptoms, then or even hot flashes, they should just consult the doctor once, and then just lead a normal life. But women who are below the age of 40, I had mentioned this earlier also. So, below the age of 40, they should not have menopause. And if they have perimenopausal symptoms or menstrual irregularities, then they should go for
Go see a doctor.
so women should not normally have menstruation menopause below the age of 40 years. They should have a full medical investigation if they have very menopausal symptoms or irregular menstruation. They should have a full medical investigation. And all women after menopause should have workup for their bone health and their cardiovascular health like serum calcium level, bone density test, annual checkup for different parameters of the body should be started and continued.
Okay. All right, friends, this is an absolutely natural process. So do not worry about it. But in case you are facing any symptoms below the age of, and if you are below the age of 40, please do consult your doctor. Um, and Doctor, what you did mention about the hormonal replacement therapy. So, what is that, and is it recommended for all women who have menopause or who are in the menopausal stage?
See, I mentioned earlier that estrogen hormone it acts on several parts of the body, so different organs of the body like liver, brain, heart, lungs, bones, skin. So estrogen has an impact on all these organs for their normal functioning. And menopause is associated with low estrogen level in the body. And these lead to changes in the functioning of these organs that are normally used to having estrogen support in their normal function. So hormone replacement is given to make correct the level of estrogen in the body. So it is given for treatment of symptoms like hot flashes and night sweats, and also for women who undergo hysterectomy, that is removal of the uterus or removal of the ovaries at an early age. Then they are given supportive hormonal therapy till they reach the natural age of menopause. There was a time in the 1980s and 1990s when postmenopausal treatment with hormone replacement was done very rampantly, like almost in the West, especially. Most women who were postmenopausal, they were given the hormone replacement therapy. But there was a study done in 2002, and it was done by Women Health Initiative, and it showed that women who were given the hormone replacement, they had increased number of cases of breast cancer and heart disease. So at that time, once this study was published, the prescriptions for hormone replacement therapy dropped drastically. But over the years, people looked at the study itself and tried to find different methods to do the study again. So more rigorous and more robust studies were done. And then there is a general consensus now that if the right estrogen is given at the right age, in the right dosage, and for a right duration, then it is generally more beneficial than harmful. Hormone replacement therapy also can be started in women below 50 years of age or within 10 years of their menopause. And this can be safe and prescribed provided they don't have any comorbidities like hypertension, diabetes, high cholesterol, heart disease, personal and family history of breast cancer. So I think now everyone after the COVID vaccine, they know about comorbidities. So if you have comorbidities and if you are with your doctor, even if the doctor does not ask for, your history of your comorbidities, you must be upfront and tell the doctor about your comorbidities before any hormone replacement therapy is started for you. So for women between 50 to 60 years of age, the doctor should always weigh the benefits and risk. And if the benefits are more than the risk, then the HRT can be given. This is for women between 50 to 60 years of age. HRT can also be given to women above the age of 60 years, but a lot of caution has to be taken. A lot of consideration should go into before this treatment is started. And for women above 70, the HRT is a no-no. They should not be given any hormone replacement therapy. So I would like to say that women, when they go to their gynecologist with probably if they are having severe symptoms, hot flushes, mood swings are too much, they are gaining too much of weight. So there is something that they are not able to deal with, and they go to their doctor and they are discussing the HRT treatment for them. They should really talk about the pros and cons of the hormone replacement in their particular case and not in general. So they should ask the doctor whether it is going to benefit her and in what ways it is going to benefit her and in what ways it is going to be harmful for her. So it should not be that, it's a generalized therapy. So it should be really tailored made for the woman who is going to have the hormone replacement.
Right. Thank you. Thank you, doctor. So friends, please do consider, speak to your gynecologist and take different opinions before you take the hormone replacement therapy. And do not forget to tell your doctor about your comorbidity issues if you have any. Doctor, according to you, what the diet recommendations for menopausal women?
So diet is very important for anyone at any stage of life. And women at menopause are increasing in age and their metabolism slows down. So with increasing age, slowing metabolism means that they are burning fewer calories and even when they are at rest or during activities. So their consumption of calories goes down. So in this case, if women, they don't reduce the intake of the food, they will gain weight. So women at menopause should be very careful about what they eat. And I told you that estrogen also has an effect on the heart, and the low estrogen causes the increases the vulnerability of women to heart diseases. So they should be very mindful of what they are eating. So the diet should be low in calorie, it should be low in salt, and it should be low in sugar. And their diet should be very rich in vitamins and especially vitamin D and calcium. Green leafy vegetables, whole grain, daily requirement of protein and unsaturated fat, that should be part of their diet. So they should also take vitamin supplements, mineral supplements. They should reduce alcohol. They should reduce caffeine intake, spicy food, hot beverages. So I think this was also covered in the talk by Dr. Anjali in when we were talking about nutrition of women in the last episode.
That's right.
And yeah, so there is really no need to starve yourself, but if you practice mindful eating and moderation in everything that you eat and drink, so that would really help.
Right. So basically, healthy living and mindful eating. Don't
Comes
forget your
again.
calcium, green leafy vegetables, and everything that we have always been told, right?
The simple hard part.
Absolutely. So, doctor, what is your advice to family members or friends when they are dealing with someone who is going through this menopausal phase?
So, as you know, that family support is very important in anyone's life and throughout everyone's life. And menopause is actually not a disease. So, family members actually are not able to understand what a woman is going through. And there are always some ladies in the family who have not felt the pains of transition. So, even females don't understand it. So I think I would recommend talking openly with the family about what you are feeling, and this will help them understand you and understand why you are behaving in a particular manner. You can also let them know in ways the ways in which they can help you cope with your symptoms. So that is very important. So open communication with the family, expressing your inability to do something or their help in making you feel comfortable, that is very important. Next, I would say that one should also have a large number of female friends with whom you can discuss your problems of menopause, because everyone is going through similar situations. So you will find that you are not the only one. There are others also having, different symptoms, and everyone is having a coping mechanism. So you can learn from each other. So family and friends will really come handy and very useful when you are trying to transition from your menstrual cycles to a menopause stage.
That's true. That's true. It is so important to actually have those female friends because they have always been a support system for us. And knowingly or unknowingly, we have learned so much for discussing these things with our friends, right?
Yes, yeah.
And I think communication is so important, be it your family member, be it your friends.
Friends.
Communicating, I think, makes it also easier to deal with this issue.
Yeah, because if you just expect people to take care of you without telling them what is your requirement, it's really no one is a mind reader. So, you may be having a lot of issues. Unless you talk to someone about it, how will they know what you're actually feeling? So, as I said, no one is a mind reader. You just sit and expect something from someone. It is never going to happen. But yeah, if you reach out to your family and friends, then I'm sure not everyone, but someone will respond to you in the manner that you want to.
True. And to all our viewers, sometimes PMS and menopause become part of jokes or judging one's actions. But please remember, this is not a disease. It is just a phase, and it is okay to talk about it and discuss this. So, Dr. Vinita, we are coming towards the end of today's session. And as your closing words for tonight, please do tell our viewers about a holistic well being and how can a woman embrace this challenging yet inevitable phase. And if you have any other words that you would like to tell our viewers.
So I think the most important thing, as we have emphasized throughout this discussion, is that menopause is a physiological phenomenon and it is not a disease. So don't be afraid of it. You know, it is just a natural phase, like I said, graying of hair, losing teeth. Some people lose that as they grow older. So that is just a regular phenomena. The menses will stop and they will stop permanently. And not all women face the menopausal symptoms. There are some who face menopausal symptoms. And for that, they can, do self-help like weight loss. They can also, do some physical activity, yoga, meditation, breathing exercises, improving the sleep quality, reducing the stress in life, engaging in new activities, and making more female friends, I would say, for sure. And there are other ways of treatment like hormone replacement therapy. And like I said, right estrogen, right age, right dose, right duration might really help. So these are the different ways in which they can cope with the menstrual perimenopausal or menopausal phase, postmenopausal phase. In summary, I would like to tell women who are between the age of 30 and 45 years that they should actually prepare for menopause. And how do you prepare for menopause? Well, you can start a healthy lifestyle that is sustainable. Don't be too ambitious, because if you try to do something very ambitious and you're not able to sustain it, then it's a loss. So try to start a healthy lifestyle, like your food preferences, try to adjust to that, then become more active in what you are doing, have a more positive attitude in life. And these will not only reduce the menopausal symptoms, but they will have limitless other health benefits too. And it will not only benefit you as an individual, it will also benefit your whole family, because you are a very integral part of the family. And for women who are in the age group of 45 to 58 years, I would say that you manage your symptoms. And as I have discussed, as Vaishali said, it was a very long one answer, but you may go back and listen to what I told about the different symptoms and how to deal with them. And you have to remember that every one of us is unique. So you have to find out what works for you and what does not work for you. So you have to find your own comfort zone. And for women who are above 58, I would say you maintain your healthy lifestyle. And at that age, you are more prone to have mental health issues like dementia and Alzheimer's to start developing. So at that age, you should start doing more exercises, more mental exercises also, like at that time, Sudoku or learning new language, learning new sport, learning musical instrument, something new, and using the non-dominant hand to do your daily work. That will really help, and it will help you delay the dementia and Alzheimer's disease. So this is all I can say about menopausal care.
Thank you. Thank you so much, Dr. Vinita. That was really a very beautiful, wonderful, informative session. Yes, with all this information that you have just given us today, I think um, it makes us more stronger in facing it. So friends, that brings us to the end of today's question and answer segment. And the key takeaway points for us are: menopause is a new beginning. Enjoy your freedom from monthly hassles and the fear of getting pregnant. Spend time on yourself. Be creative. Learn new talents. or rediscover old, discover yourself. Be happy that you are a unique person. There is no photocopy. Enjoy your uniqueness. And yes, don't forget your female friends. Make a lot of female friends. Dr. Vinita, thank you so much once again for your time and the knowledge that you have shared with us. Friends,
Thank you
that
so
was
much,
Dr. Vinita
Vaishali.
with us telling us about menopause, changes, and challenges. Oprah Winfrey had once said, she said, so many women I have talked to see menopause as an ending, but I've discovered this is your moment to reinvent yourself. And after years of focusing on the needs of everyone else, it is your opportunity to get clear about what matters to you and then to pursue that with all your energy, time, and talent. That was what Oprah Winfrey said, and it is so true. And I am sure this will resonate with many of you out there. Friends, do share this video of awareness and help us spread the word globally. Don't forget to tune in on every first Wednesday of the month for Ivy's Wellness Wednesday. Watch the space for more details. Do keep asking us your questions and we will get the answers for you. Until then, eat well, take care, stay healthy, and most importantly, educate and spread awareness. Because a better I is a better we. This is me, Vaish, your host for Wellness Wednesday, signing off. Good night and namaste.